Namaskar and welcome. You're watching News Night. As nation continues to battle Covid-19 pandemic, government and its various agencies continue to work on war footing to grapple with the current situation. And as nation's national news broadcaster, we at DD News and DD India stand firmly with the frontline workforce and those who continue to battle it out day in and day out. Well, these are testing time viewers, and your channel, DD News and DD India, is with you. And we at the same time lay more and more stress on following COVID protocols, including wearing masking up even if you're indoors also. Well, that's the practice we follow here on national broadcaster DD News. And on News Night tonight, we put in focus India's COVID fight back and the progress made on the vaccination coverage and the related news. I'm Sakal Bhatt, and to begin with, on News Night, here are the headlines. Augmenting oxygen supply continues on war footing. Oxygen express operations expand to Haryana and Telangana after Maharashtra, UP, Madhya Pradesh and Delhi. Cumulative liquid medical oxygen carried by Indian Railways to reach almost 640 metric ton in next 24 hours. Indian Air Force flies in oxygen containers from Bangkok, Singapore and Dubai. Vaccination campaign against COVID-19 continues. Cumulative inoculations cross 15 crore. Registration for phase 3 of vaccination for those between 18 and 44 years continues. Over 87 lakh registrations on Thursday. Bharat Biotech cuts rates Covaxin for states to ₹400. War against COVID intensifies across India. Uttarakhand government postpones Char Dham Yatra. UP extends weekend lockdown to 3 days. Lockdown in Goa till Monday morning. Jammu and Kashmir administration announces 84-hour-long lockdown across 11 districts. Union Health Minister Dr. Harshvardhan reviews COVID facility at Lady Hardinge Medical College, says India has one of the lowest mortality rates in the world, but each and every death is tragic and painful. Health Minister asserts that the biggest weapon against COVID-19 is following COVID-appropriate behavior and wearing masks. Prime Minister reviews Army's preparedness and initiatives for COVID management. Army Chief informs Prime Minister that Army medical staff are assisting state governments. Defence forces are setting up temporary hospitals for civilians in various parts of the country. Global aid continues to pour in. Consignments from Russia, Britain and Romania land. Oxygen concentrators from Germany also delivered. Norway pledges aid worth $2.4 million American dollars. US dispatches oxygen cylinders. Regulators, rapid diagnostic test kits and N95 masks. Union Health Ministry issues revised guidelines for home isolation of mild or asymptomatic COVID-19 cases, mandates use of triple-layer medical masks by patients and caregivers. Home isolation can end 10 days after first day of symptoms and 3 days of no fever, no retest required. In other news, 8th phase of polling in West Bengal concludes. Over 75% of voter turnout recorded, counting for all 5 state assemblies on 2nd of May. Exit polls predict a win for BJP in Assam. Split verdict amongst pollsters for West Bengal. They say DMK will win Tamil Nadu, BJP may lead in Puducherry. LDF government predicted in Kerala. And now for the top stories in details. First up, we look at the strategy adopted by states. More and more states are now adopting a lockdown strategy to break the chain of COVID infections. Now the numbers, more than 21 lakh doses of vaccine has been inoculated. These have been administered, while over 2 lakh recoveries have been reported in the last 24 hours. Well, the good news is that there are at least 6 states or union territories where no death has been reported. The COVID-related death has been reported in the last 24 hours as well. Here is an overview of how states are putting up the fight to contain the situation.
The country's war against the coronavirus pandemic continues. Restrictions are being tightened in the states to curb the growing cases of coronavirus in the country. In view of the increasing cases of corona infections in UP, the state government has increased the 2-day curfew to 3 days as the coronavirus curfew has helped in reducing the prevalence of the infection. An extended weekend curfew from Friday 8 p.m. to Tuesday 7 p.m. will be in place. Only essential services will continue uninterrupted. Industrial activities and vaccinations will also continue.
शुक्रवार रात्रि 8 बजे से अब मंगलवार प्रातःकाल 7 बजे तक जो साप्ताहिक बंदी को एक्सटेंड किया गया है उसका विस्तार कर दिया गया है। इस दौरान पूरे प्रदेश में गांवों में और शहरों में सैनिटाइजेशन का, साफ सफाई का, स्वच्छता का एक पूरा अभियान चलाया जाएगा। इस दौरान औद्योगिक गतिविधियां चलती रहेंगी।
Availability of remdesivir across districts is being ensured. It is available free of cost in government hospitals. COVID hospitals are being set up in Lucknow and Varanasi in collaboration with DRDO. Meanwhile, the Uttarakhand government has postponed Char Dham Yatra because of the surge in cases. Though the 4 dhams will open at the appointed time, only priests and sadhus living there will be allowed darshan.
चार धाम यात्रा को लेकर के अभी जिस तरह कोविड है तेजी से बढ़ रहा है उसको देखते हुए स्थगित किया जाता है और साथ ही केवल पुजारी वही वहाँ पूजा पाठी करेंगे। बाकी कोविड को देखते हुए सभी स्थगित इसको हम कर रहे हैं।
The lockdown in Goa will remain in place from Thursday till 3rd of May. Essential services and industrial activities will be allowed. Public transport, nightlife and casinos, hotels and pubs will remain closed. Vehicle related to essential services will be allowed on the roads. In Karnataka, Chief Minister B.S. Yadurappa reviewed the status of COVID in all the districts of the states via video conferencing. He urged the local administration to strictly implement all guidelines as well as conduct audits of remdesivir and oxygen. Karnataka Revenue Minister R. Ashoka visited a newly built COVID center in Bengaluru. Union Minister Prahlad Patel launched a free ambulance service in Hubli. In Kerala, vaccinations are continuing at a rapid pace. One such camp is at Jimmy George Stadium in Thiruvananthapuram.
Online, I booked this one. When I came here, they say your first one is not vaccinated. I approached the help desk and they sorted out the problem.
The Jammu and Kashmir government has decided to impose an 84 hours lockdown in 11 districts. These districts are Srinagar, Budgaon, Anantnag, Baramulla, Ganderbal, Kulgam, Pulwama, Kathua, Riyasi and Udhampur. The curfew in these districts will be effective from 7 p.m. today and will continue till 7 a.m. on Monday. During this period, only the movement of essential services will be exempted. In Haryana, Chief Minister M.L. Khattar visited the Ambala Civil Hospital and also inspected the oxygen plant in the area. He said that small hospitals in the state will be allowed to admit COVID-19 patients without any need for permissions.
पूरे प्रदेश में के जो छोटे हॉस्पिटल्स हैं बिना परमिशन के कोई भी कोविड के पेशेंट को एडमिट नहीं करेगा। अगर कोई कोविड के पेशेंट को बिना परमिशन के जिसके पास लाइसेंस नहीं है उसका वो अगर करता है तो उसके खिलाफ कार्रवाई करेंगे।
Efforts are in full swing to meet the oxygen requirement in Punjab. For this, the state government has also approached Jharkhand and Chhattisgarh.
हमारे पास 300 मीट्रिक टन की पर डे रिक्वायरमेंट है, जबकि हमारे पास जो हमारी अपनी प्रोडक्शन है सारे साधनों से वो 36 मीट्रिक टन है। 105 टन बाहर से आती है और बहुत बड़ा गैप है, लेकिन उसको गैप को पूरा करने के लिए हमने कुछ झारखंड छत्तीसगढ़ से भी कॉन्टेक्ट किया है हमारे सरकार ने।
In Bhopal, shops were closed and roads deserted during the corona curfew. Traffic police were seen checking vehicles. The curfew will remain in force till 3rd of May 6 a.m. Strict restrictions are in place in Ahmedabad to break the chain of infection. Madhya Pradesh Chief Minister Shivraj Singh Chauhan addressed doctors, nurse, paramedical staff via video conferencing and appreciated their work.
कि अगर लोग स्वस्थ होते हैं तो आधे दवाई से होते हैं, आधे आपके मनोबल बढ़ाने से, आपके व्यवहार से ठीक होते हैं। बिना विश्राम किए आप काम कर रहे हैं, समाज के ऊपर ऋण है ये आपका।
In Delhi, all efforts are being made to ensure availability of oxygen in hospitals. Several NGOs as well as private organizations are running oxygen lungers where oxygen is being made available to the people in need or those waiting for hospital beds.
हमने ऑक्सीजन के बड़े सिलेंडर इंतजाम किए, हरियाणा से, पंजाब से, दिल्ली से भरवाए। 100-150 लोगों को मैं समझता हूं सहूलत होगी। हम उनकी जान बचाने के लिए शायद कोई सहूलत दे सके।
Talking about Maharashtra, the state government as well as private institutions are doing all they can to help people. The Ganesh Kala Krida Manch, a community sports organization in Pune, has transformed the sports complex into a mini hospital where patients will get all the facilities.
कैजुअल्टी से लेके वार्ड, लैब, एक्सरे, सब जो हॉस्पिटल का जो सेटअप है वो एवरीथिंग इज रेडी नाउ.
Overall, collective efforts to tide over the Covid-19 pandemic are being made across the country. Bureau Report, DD India.
And continuing the momentum and multi-pronged strategy to contain the COVID crisis, government's exhilarated fight back continues. On Thursday, Chief of Army Staff General M.M. Narwane called on Prime Minister Narendra Modi and apprised him of various initiatives being taken by the army to help in COVID management across the country. Now, amidst this unprecedented COVID fight back, the country continues to immune population against COVID-19, with India crossing a major landmark with more than 15 crore cumulative vaccination coverage. Here's a report.
Government continues to work on war footing to deal with the second wave of coronavirus that has hit the country, adopting a multi-pronged strategy. Chief of Army Staff General M.M. Narwane called on Prime Minister Narendra Modi on Thursday and apprised him of various initiatives being taken by the army to help in COVID-19 management. General M.M. Narwane informed the Prime Minister that medical staff of the army is being made available to various state governments. He also briefed the Prime Minister about temporary hospitals being set up in various parts of the country. Army is opening up its hospital for civilians wherever possible, and citizens can approach their nearest army hospitals. General M.M. Narwane informed the Prime Minister that the army is helping with manpower for imported oxygen tankers and vehicles where specialized skills are required to manage them. Indian Army established a dedicated COVID facility at the old Command Hospital complex in Pune, where substantial capacity has been created for treating the local people referred by the district medical officer. A 900-bed hospital is being set up in Ahmedabad and a 100-bed isolation facility in Barmer, Rajasthan. A 150-bed facility in Bhopal and two 40-bed facilities have been established in Gwalior and Sogor. 3 naval hospitals under Western Naval Command INHS Jivanti, Goa, INHS Patanjali, Karwar and INHS Sandhani, Mumbai have kept ready a few COVID oxygen beds for use by the civil administration. Meanwhile, Union Health Minister Dr. Harshvardhan on Thursday took stock of COVID care infrastructure of Lady Hardinge Medical College in National Capital. He announced further enhancement in bed capacity at Lady Hardinge Medical College.
ये भी आज एक बहुत महत्वपूर्ण निर्णय हुआ कि हमें, क्योंकि अपने ओल्ड बिल्डिंग में और ज़्यादा बेड्स को क्रिएट करना है और ज़्यादा बेड्स को क्रिएट करने के लिए वहां पर पहले ही लगभग 270 बेड्स हम लोगों ने पिछले दिनों में क्रिएट किए थे। आज उसमें 112 बेड्स का और इजाफा किया है और इसी तरीके से 30 बेड्स का इजाफा जो हमारा कलावती शरण अस्पताल है वहां पर बेड्स को एक प्रकार से रीअप्रोप्रिएट करके नॉन कोविड, और उसमें भी 30 बेड्स कोविड के लिए व्यवस्था की गई है।
Meanwhile, Bharat Biotech has announced a cut in rate for Covaxin for states to ₹400. The Union Health Minister asserted that the biggest weapon against COVID-19 is following COVID-appropriate behavior, adding there is no bigger weapon to beat corona than wearing a mask, regularly washing hands with soap and maintaining social distancing. Addressing the issue of oxygen supply, Health Minister assured that there was no dearth of oxygen even earlier, and now the production capacity has increased manifold.
देश भर में यूं तो पर्याप्त मात्रा के अंदर ऑक्सीजन उपलब्ध थी, पहले भी थी, लेकिन शायद कहीं कहीं पर ऑक्सीजन का एक प्रकार से जो ट्रांसपोर्टेशन था उसके अंदर जो गैप्स थे उसको भी पिछले समय में एक तरफ दूर किया गया है। वो गैप्स को रेल के माध्यम से, सड़क के माध्यम से, हवाई जहाज के माध्यम से, एयरफोर्स के माध्यम से, शिप्स के माध्यम से, विदेशों के माध्यम से, सपोर्ट सिस्टम्स के माध्यम से, जो इंडस्ट्री के अंदर जो इंडस्ट्रियल यूज के लिए ऑक्सीजन होती थी वहां पर भी उन प्लांट्स को जो है कॉर्पोरेट की मदद से वहां पर भी जो है हमारे लिए जो उपयोगी मेडिकल ऑक्सीजन है वो बनाने की प्रक्रियाएं शुरू हो रही है।
Meanwhile, Oxygen Express operations of Indian Railways continues to bring relief to the states as its operation expanded to the states of Haryana and Telangana after Maharashtra, Uttar Pradesh, Madhya Pradesh and Delhi. It is expected that cumulative liquid medical oxygen transported will reach almost 640 metric tons in the next 24 hours. Uttar Pradesh received its Oxygen Express carrying 76.29 metric tons of liquid medical oxygen in 5 tankers. One tanker was offloaded in Varanasi, while remaining 4 tankers are offloaded in Lucknow. Haryana will receive its first Oxygen Express with 2 tankers ready to leave Angul and Orissa. Down south, Telangana government has also requested Indian Railways for Oxygen Express. An empty rake is on its way from Secunderabad to Angul with 5 empty tankers. The Indian Institute of Technology Bombay has come up with a creative and ingenious solution to addressing the shortage of medical oxygen for the treatment of Covid-19 patients in the country. The pilot project, which has been tested successfully, relies on a simple technological hack: conversion of PSA nitrogen unit to PSA oxygen unit. In order to give some respite on meeting expenses, Ministry of Labour and Employment has included more provisions. The insured person and or his family members, if infected with Covid-19, can avail free of cost medical care in any of the ESIC or ESIS hospital that have been declared as Covid-19 dedicated hospital. Presently, 21 ESIC hospitals with 3,676 COVID isolation beds, 229 ICU beds and 163 ventilator beds and 26 ESI scheme hospitals are run by state governments. On vaccination front, registration for phase 4 of vaccination for those between 18 and 41 years continues at a rapid pace. Government has so far provided nearly 16.16 crore vaccine doses to states and union territories free of cost. In addition to this, more than 20 lakh vaccine doses will reach within next 3 days as well. Bureau Report, DD India.
Meanwhile, vaccination campaign against COVID-19 continues in full force. Cumulative inoculations have crossed 15 crore mark. Registrations for phase 3 of the vaccination for those between 18 and 44 years also continued on day 2. Continuing with more news, over 87 lakh registrations were recorded on Thursday, that is today, and total registrations as of now has crossed 15 crore 72 lakh mark. We're going to talk about that vaccination bit also with our guest on Newsnight. But before that, let's also talk about the Union Health Ministry that has issued revised guidelines for home isolation of some mild and asymptomatic COVID-19 cases. Now, as per these guidelines that have been issued for home isolation, let's try and understand them. The patient should be clinically assigned a mild or asymptomatic case by the treating doctors. In such cases should have the requisite facility at their residence for self-isolation and for quarantining the family contacts. According to this, a caregiver should be available to provide care, and communication link between the caregiver and hospital should be there for the entire duration of the home isolation. These are the revised guidelines. Elderly patients aged over 60 years and those with comorbid conditions shall only be allowed home isolation after proper evaluation by the treating doctors. Patients suffering from HIV or transplant recipients and cancer therapy are not recommended, this is important, not recommended for home isolation and shall only be allowed home isolation after proper evaluation by the treating doctors. The revised guidelines further state that the patient must isolate himself or herself from other family members especially elders and those with comorbid conditions. The patient should be kept in a well-ventilated room with cross-ventilation. Patients should be at all times, in fact, using a triple-layer medical mask. Yes, triple-layer medical mask. The patient has been advised self-monitoring of blood oxygen saturation and health and must be in communication with the treating physician and promptly report in any case of any deterioration of health. The decision to administer remdesivir or any other investigational therapy must be taken by a medical professional and administered only in a hospital setting and not at home. Also, as per the guidelines, a patient under home isolation will stand discharged and end isolation after at least 10 days have passed from the onset of symptoms or from the date of sampling for asymptomatic cases, and no fever for 3 days if that has been reported. Now, there is no need for testing after the home isolation period is over. This is as per the new guidelines are concerned. And let's quickly talk about these, and to do that in focus we talk about India fights back with multi-pronged strategy. That's going to be our in focus topic tonight. We talk about the concerted efforts made by the government and its various agencies to deal with the second wave of COVID-19. And to do so, on the show tonight we have R.S. Sharma, Chairman, Empowered Group on Vaccine Administration, and he's Chairman CoWIN, joining us on the show tonight. Yes, and we also have Dr. Ashok Seth with us. Dr. Ashok Seth, Chairman, Fortis Escorts Heart Institute and Research Center. Thank you very much, both of you gentlemen, for joining us on News. And I would like to go to Mr. Sharma. Sir, thank you so much for joining us, Chairman CoWIN. And well, first of all, just to understand what's the kind of traction that is building up for 1st of May, the numbers that we are looking at as far as the current phase of vaccination is concerned and the registrations for the next phase is concerned. The numbers are good. They're appreciating a positive sign there. Overall, if you could just explain to our viewers, what all do we need to know as far as the next phase registration that starts on 1st of May is concerned?
Well, the registration for the next phase, which is to start on 1st of May, has started yesterday at 4 p.m. So now, yesterday we had about 1.37 crore registrations. Today also, I think, as we speak, till 9 p.m., we have about 92 lakh registrations. So there is a significant number of registrations which are happening, and most of the registrations pertain to 18 to 44 years of age group. So that's one thing which is happening. Now, what is next stage is essentially when the states start vaccinations after they get the vaccines from the manufacturers, and also the private hospitals, when they get the vaccines, then they will also start. So what I expect is that some of these entities, some of the states will start on first, some of them may start a little later, because depending on the receipt of the vaccine by them, they will be able to publish their timetables, and then people will be able to get the appointments. So that's the way I look at it.
Procurement of vaccine to these states, Mr. Sharma, continuing with you, sir, on this, there's a lot of anxiety, there's a bit of a misinformation also in public domain about lack of vaccine in the states, not adequate supplies are there reportedly and all of that. If you could just assuage such fears, allay those fears that as far as the vaccine in respective states are concerned, we're looking at pan-India, there's nothing to worry about.
You see, what is happening is that the people of 45 years plus, they will continue to be vaccinated as before, because the central government, which has purchased 50% of the total supplies from the vaccine manufacturers, those vaccines will continue to be distributed and vaccinated free of cost at the state level, at this government hospitals. So that's one part. So one does not need to, kind of fear that the program now, the next phase is beginning, therefore the program has to have a reset kind of thing. There's no reset in the program.
Okay.
The vaccines will continue on and are being continued. Today also, in fact, we found about 2 million, approximately 2 million vaccinations took place. Similarly, they will continue from, on 1st of May onwards also. So that's number one. Secondly, the rest 50% of the supplies are being contracted by the state government and also the private hospitals. Now, those supplies will start flowing from 1st May onwards. So some states may get it on 1st of May, some states may get it on 3rd of May, and slowly and slowly those states will continue to get. As and when they get, they will publish their timetable and they will publish the vacancies, and immediately those vacancies for the year 18 to 44 will become visible to those people who have got registered. Even those who have not registered can register at that point in time and get a vaccine slot. So it is not, this kind of, an impression which is being created is that now this is going to stop, and now as in, it will be a long time before the vaccination in these states start is not correct. The vaccination will continue for 45 years plus, and it will also start at various points of time in the next few days in the states also, as and when they procure the vaccines.
And how effective is this going to be? Doctor, coming to you, Dr. Sethi. Now, is this going to be one of the decisive, factors when we talk about the fight back? Because there is a sort of impression artificially created by certain sections that there is shortage of oxygen and all of that. Now that we are widening, Dr. Seth, we are widening the vaccination coverage. The government has adopted a very robust multi-pronged strategy. Only on this vaccination bit, how effective and decisive is this going to be in terms of, creating that sense of ease finally that we are able to get the situation under control?
So let's understand this, that this is the most appropriate concept. Of the two weapons we have against COVID fight, this vaccination is an important, perhaps one of the most important weapons. We must also understand the COVAX mission, and that is no one is safe unless everyone is safe. No one's protected unless everyone's protected. So vaccination for all is the right approach. One needs to understand that there are two benefits of vaccination, and I want to really, this is for your viewers.
Sure.
On a personal level, it protects you with greater than a 70% certainty that you're not going to catch COVID, and with 100% certainty that you can't have serious COVID or get sick enough to get close to death or have a deadly disease. Now that's what we really want, to be alive and safe at the end of the day. And that's a very important aspect. Clearly, the effects of vaccination have also been demonstrated that it decreases the chances of your own family having disease process by 50% if you get yourself vaccinated. That's been clearly shown. And even a single vaccine dose provides you with a 60 to 65% certainty of protection. Now, that's a huge step forward in not just protection of yourself, but protection of your family and others around you. And finally, it prevents the overwhelming of the healthcare system, which we've just seen. If serious cases get prevented and if deaths get prevented, our system doesn't get overwhelmed. And therefore, we're going to see the benefits of vast vaccination on a personal level happening over the next few weeks. But finally, on a community level, on a national level, it is the only way to get herd immunity when 70 to 75% of the population, which includes you, which includes me, which includes my friend, which includes my family, all of us get vaccinated. And that's the only way we will throw the virus out and stop the virus. So it's so important an attempt to get rid of the virus from across our country and certainly across the world. And that is why this emphasis on vaccination, vaccination, vaccination. And while we talk about that, we must remember that the second weapon is equally important, because that's the weapon of COVID appropriate behavior, of masking, and nowadays double masking, I must say, a surgical mask over which a cloth mask or an N95 mask will have to continue primarily, because till you can actually catch the virus, even though you may be asymptomatic. You want to be sure that you don't transfer it to others. And if these mutant viruses keep coming as we go along, then the best protection against mutant virus immediately is the social vaccine, which we always say. So I think we've got to combine those two. They're not mutually exclusive, but if we combine those two, we get rid of this worst enemy we've ever seen in our lives. We're at a war at the moment. We shouldn't do anything to propagate and help the enemy. We've got to destroy the enemy, which is the COVID-19 virus.
You started by saying, Dr. Said, 70% certainty. We were talking about the efficacy of vaccine. Very reassuring, sir. In fact, if you could elaborate a bit on it, because there also seems to be a certain sense of apprehension somewhere. Some people, like, there are numerous misinformation campaigns running. We on Doordarshan are regularly running the PIB fact check also, where questions are being raised, and questions have been raised on the efficacy of vaccine. Let's demolish this myth once and for all, that vaccination is the answer.
It is clear. 70% efficacy, or with Covaxin it's 78 to 80%. We have to understand that means huge amount of protection. And when we talk about prevention of serious disease and a second infection and death, then if we have a just flu-like illness, khansi, zukam, sardi hoke chali gayi, then what do we have to worry? And yet, look at the amount of people which are dying. Now, look at the government data, and it's now clearly amongst us transparent. Britain has shown a decrease in COVID infections in those vaccinated to greater than 70 to 75% with the present vaccines which we have at the moment. Look at what came out of CDC of United States for Covaxin.
Okay.
It said that it actually can prevent infections
Dr.
from
Said,
even the mutants.
Dr. Said,
that's so important.
Yes.
Yes.
Dr. Said, I have to wrap it up, but I have to take final comments from both of you. In fact, since you're talking about vaccine, and in the capacity of the doctor, in fact, if you could just send across a message, because we all want to know, sir, when we are going through a critical phase, when is this nightmare going to get over? When will we be in a position to reach the plateau? And then finally, when do we get to see the graph or a curve coming down?
So I think you've got to be a soothsayer or a predictor for all this. And nobody can actually answer this absolutely convincingly and confidently. But I can tell you that if we all fight together this battle and get vaccinated, we will actually see a peak, hopefully in 2 to 3 weeks, 4 weeks, and it will start going down. Because we would have actually got ourselves vaccinated, because we would have actually taken a COVID-appropriate behavior, because we would have combined together to beat this virus. So we have to understand the implications of what we're doing. We've got to this worst situation because of our own fallacies, because of our own faults, because of our own lack of COVID-appropriate behavior, and our callousness and carelessness. Now let's gear up for this warlike situation and do what we can, and we will win this war. I'm very hopeful, provided we understand the way to win this war. And there are only two strategies: vaccination and COVID-appropriate behavior. Get them together.
Focused approach. And Arish Sharma ji, he is also chairman of the Empowered Group on Vaccine Administration and COVID German. Your message to the viewers of national broadcast: vaccine administration, the robust systems are in place to ensure A, that there is no shortage, B, that there is last mile delivery.
Absolutely. I want to join Dr. Seth in saying that, if we in India have a very sophisticated system of vaccine administration, because we are the only country which are issuing a digital certificate which is verifiable, non-reputable, which is actually happening online, real time. We are ensuring that a person who gets vaccine X in the first instance also gets the same vaccine next time. So, and we are having a complete granular information at the individual level so that nobody misses the second dose. So I think with that kind of system in place, and all these states and UTs and everybody, all the doctors, nurses, paramedical staff working overtime to ensure vaccination to our people, I think we are all set to fight this virus in a very, very effective manner. And you will see in the days coming forward, we started at 2 lakh vaccinations per day.
Yes,
and
sir.
in the last about 15-20 days we have been doing, so on some days we are doing 4.5 million, 45 lakhs. So it's a huge number which we have done. In any case, we have done about 14 crore plus vaccinations thus far, which is also a very significant number.
Right,
so
sir.
we are not behind. If you look at the whole world situation, we are absolutely on track. And I think with the more and more coverage happening and more vaccine getting accelerated with the
Right,
new
sir.
liberalized policy, I am sure we will accelerate this process very fast. And as Dr. said, rightly said, vaccinate. That is going to be the new mantra, which we will have to take care, and we will ensure that we are able to effectively fight this virus.
Absolutely. Yes, on that positive note, and thank you very much for your assurances also. Thank you so much, R.S. Sharma, Chairman Empowered Group on Vaccine Administration and COVID Chairman, for joining us on Newsnight, and also thanking Dr. Ashok Seth, Chairman, Fortis Escorts Heart Institute and Research Center. Both of you, many thanks for joining us on Newsnight. And now, staying with more news and updates, while COVID cases continue to increase, it is important to remember that the national recovery rate is also increasing. It stands at 82.10%, which means nearly 2,70,000 recoveries were registered also in the last 24 hours. Now we're going to listen into some testimonies of those who have recovered.
मुझे नवंबर में कोरोना हुआ था और उसके बाद जब डॉक्टर से सलाह ली गई तो डॉक्टर ने मुझे कुछ मेडिसिन दी। 17 दिन का क्वारंटाइन मुझे किया गया। मैं घर में ही आइसोलेटेड रहा और सभी नियमों का मैंने पालन किया। नियमों का पालन करने का परिणाम यह हुआ कि आज मैं और मेरा परिवार सभी सुरक्षित हैं।
तो मैं ये कहना चाहूँगी कि कोरोना से हमको डरना नहीं है, घबराना नहीं है। क्यों? क्योंकि देखिए पिछले दिनों मैं भी इससे पीड़ित रही हूँ और मैंने डॉक्टर की सलाह के साथ साथ बहुत सारी चीज़ों का, बहुत सारी बातों का ध्यान रखा है। मैंने अपने आप को सबसे पहले क्वारंटाइन किया था 14 डेज़ के लिए, और सबसे बड़ी बात कि मैंने डर को हावी नहीं होने दिया, क्योंकि देखिए डर के आगे जीत है।
मैं कोरोना पॉजिटिव था। मैं बिना घबराए हुए डॉक्टर के पास गया। डॉक्टर ने पूरी दवाइयाँ लिखी, मैंने वो दवाइयाँ पूरी ली। अब मैं बिल्कुल ठीक हूँ। मैंने लोगों को मोटिवेट भी किया। मैं पूरे कोरोना प्रोटोकॉल का पालना कर रहा हूँ। साथ ही लोगों को मोटिवेट भी कर रहा हूँ कि मास्क लगाएं, 2 गज की दूरी बना के रखें।
Okay, and aid continues to pour in from world to counter India's COVID-19 second wave. Around 15 countries, including US, Russia, France and UK, have pledged their support, rushing critical emergency supplies, including to enable India counter the second COVID wave. Now, countries are sending hundreds of oxygen concentrators, respirators and large quantities of liquid oxygen to help ease the difficult situation in India, the gesture that has been deeply appreciated by India with a lot of gratitude. Here's a report.
The world continues to come to the aid of India as the nation battles the second wave of the COVID-19 pandemic. 2 Russian flights with oxygen concentrators, lung ventilation equipment, bedside monitors, medicines, including Coronavir and other essential pharmaceutical items landed in India to help the country in its fight against the COVID-19 surge.
2 urgent flights operated by the Russian Amercom arrived here today. These are oxygen concentrators, lung ventilation equipment, bedside monitors, medicines including Coronavir, and other essential pharmaceutical items. Joint fight against the coronavirus threat is one of the most important areas of our cooperation at present. It also includes the forthcoming deliveries of the Sputnik V vaccine starting from May 2021 and the subsequent facilitation of its production in India.
Cooperation with UK also continues. Another shipment from UK containing 120 oxygen concentrators arrived early this morning. The UK has said that it will send further vital oxygen equipments to India in support of the country's fight against COVID-19. 3 oxygen generation units will be sent from surplus stocks in Northern Ireland to support India by providing more oxygen to those suffering from Covid-19. The oxygen units are each capable of producing 500 litres of oxygen per minute, enough 50 people to use at a time. This follows the UK's recent action to support India with 495 oxygen concentrators and 200 ventilators sent from surplus stocks. The first batch of these medical supplies arrived in Delhi around 1 a.m. local time on Tuesday, 27th of April. British Minister for Middle East and North Africa James Cleverly said that Britain will provide India with 3 mobile oxygen factories to support the country's battle against its second wave of coronavirus infections. India has set its priorities clear, and liquid medical oxygen and drugs in shortage top the list.
We have, as I mentioned, prioritized certain areas. I think oxygen, liquid oxygen is one of the areas that has been a priority. We've also seen the requirement for anything that produces, equipment that produces oxygen, oxygen generators, oxygen concentrators, oxygen producing equipment, cryogenic tankers, transportation equipment for oxygen. We've also needed some urgent pharmaceutical products like remdesivir and tocilizumab, which is also a drug that is quite urgently required. Although we produce remdesivir, but given the requirements, obviously the production has not been adequate to meet the immediate shortfall.
The US has dispatched its first batch of Covid-19 relief materials to India, including oxygen cylinders and regulators, rapid diagnostic test kits and N95 masks. The White House has said that US would be sending supplies worth more than $100 million to India to meet the urgent health needs of the Indian people. The Joe Biden administration has also redirected its own order of AstraZeneca manufacturing supplies to India, which will allow it to make over 20 million doses of Covid-19 vaccines. The US Centers for Disease Control and Prevention has locally procured oxygen cylinders and will deliver them to support hospital systems across India. The US is also providing the first tranche of a planned 20,000 treatment courses of the antiviral drug remdesivir to help treat hospitalized Covid-19 patients.
The first supply has already taken off today, and subsequent sorties will be taking place. There are a number of areas, especially relating to oxygen, therapeutics, particularly remdesivir and its different variants. The kind of stuff that is needed is being supplied, and it is being done as it is being assembled, it is moving. Now that is the administration side. On the private sector too, FedEx and a number of private companies are undertaking special sorties which will take the equipment and the oxygen related stuff, etc., which are required in India, would be ferried by these private companies.
The first consignment of oxygen concentrators from Germany arrived in Delhi on an Air India flight on Thursday. More such consignments will follow. Bangladesh is ready to dispatch approximately 10,000 vials of injectable antiviral, oral antiviral, 30,000 PPE kits and several thousand zinc, calcium, vitamin C and other necessary tablets for the people of India on an emergency basis in view of the corona situation in India. Expressing deep sorrow and condolences at the loss of lives in India due to the spread of the Covid-19 pandemic, Bangladesh expressed solidarity with India. It said at this critical moment, Bangladesh is ready to provide and mobilize support in every possible way to save lives.
Over 40 countries, and these are not just developed countries, our neighbors, Mauritius, Bangladesh, Bhutan, have all come forward to offer assistance in whichever capacity is possible.
The Norwegian government has announced a contribution of 20 million Norwegian kroner or $2.5 million towards Covid-19 relief in India. It will be channeled through the World Health Organization and the International Federation of Red Cross and Red Crescent Societies. The Norwegian support will be used to scale up ambulance services, blood donation services and medical helplines, buy equipment such as oxygen tanks for ambulances and procure and distribute hygiene products to migrant workers seniors and other vulnerable groups, among other things.
To all our Indian friends, in this time of crisis, today we stand with you. Our deepest sympathy and support to everyone. Norway is making a contribution to the efforts of the Indian government and its people. Through funds via the Indian Red Cross and the World Health Organization, it will be possible to scale up ambulance services and buy equipment such as oxygen tanks. We are with you, with the hope that the second wave will recede soon. Namaste.
Government of India is doing all it can to ensure speedy distribution of aid coming in. Every stakeholder, be it India's civil aviation sector or the customs department, are doing their bit in the unrelenting fight against COVID-19.
Our objective is to ensure that we channelize all of this assistance that is both sought by us and being received in a manner that is as effective as possible. In other words, how do we receive it? How do we ensure that we facilitate quick clearance, and not only that, we ensure that all of this is taken to different parts of the country where it is needed most critical areas. In that context, of course, we have had very strong interministerial and interagency cooperation. Cabinet Secretary has been overseeing this process himself.
Defence Minister Rajnath Singh spoke to the Defence Minister of Singapore about reinforcing capacities to fight against the second surge of COVID-19 pandemic. He expressed his deep appreciation of Singapore government's efforts and support in assisting India in these difficult times. On Wednesday, 2 plane loads of oxygen cylinders were sent to India from Singapore. A total of 256 refillable cylinders were sent by the Singapore Air Force on C-130 planes. Romania too is delivering urgent aid to India. 80 oxygen concentrators and 75 oxygen cylinders have been dispatched under EU solidarity efforts. Bureau Report, DD India.
And now let's take a look at what else is making news around India in our News at Glance segment.
Voting for the last phase of assembly polls in West Bengal ended today. The state recorded 76.07% voter turnout till 6:30 p.m. The counting of votes will take place on 2nd May. Exit polls predict a win for BJP in Assam. The verdict for West Bengal is a split verdict, one with some pollsters going the BJP way and others predicting a TMC return. Exit polls say DMK will win Tamil Nadu, BJP may lead in Puducherry, and an LDF government is predicted in Kerala. The Bombay High Court today asked the Maharashtra government if it was time to think of imposing a lockdown like last year for 15 days to control the spread of coronavirus. A division bench of Chief Justice Dipankar Datta and Justice G.S. Kulkarni was hearing a public interest litigation seeking proper management of medicines, oxygen and beds for COVID-19 patients. Chief Justice asked the Advocate General Ashutosh Kumbhakhuni if the state believed its current restrictions on the movement of citizens were working and that people were out on roads only for urgent business. Maharashtra police have filed an FIR against former Mumbai Police Commissioner Parambir Singh and 26 other policemen at Akola in Vidarbha after a police inspector levelled corruption charges against him. Police Inspector B.R. Ghadge in his complaint had made a series of allegations of corruption against Singh and other officers in the period when the former Mumbai CP was posted with the Thane police. Ghadge, who is now posted in the Akola Police Control Room, had also alleged that after he refused to obey Singh's instructions, 5 FIRs were registered against him and he was suspended. Mumbai Police has issued summons to senior IPS Rashmi Shukla and asked her to be present before the Cyber Police Station tomorrow. An FIR was registered against unknown persons on the complaint of Maharashtra Chief Secretary Sitaram Kunte to CM Uddhav Thackeray, alleging that Shukla may have leaked a confidential report on transfer of police personnel in the state to leader of opposition Devendra Fadnavis. It was also alleged that Shukla had unauthorizedly tapped phones in the year 2020. Rajasthan Chief Minister Ashok Gehlot today announced he had tested positive for COVID-19. He said he was feeling well and did not have any symptoms. Gehlot's wife Sunita, who had earlier tested positive, is being treated for the infection. Former Prime Minister Manmohan Singh was today discharged from All India Institute of Medical Sciences, Delhi. He was admitted to the AIIMS on April 19th after he had fever and tested positive for the novel coronavirus infection. Assam DGP Bhaskar Jyoti Mahanta today said that a top ULFA militant was killed during an encounter with security forces in Bongaigaon district of the state today and one of his aides arrested. Vipen South, the newly appointed leader of Fulfa Western Command, was shot dead during an exchange of fire with security forces in Monkeypur police station area. According to the DGP, high-quality police intelligence inputs led to the successful operation.
Well, let's get you some international news. When US President Joe Biden delivered his debut speech to a joint session of Congress on Wednesday, history was made actually behind him, with two most powerful women taking their positions or places on the rostrum for the first time. Speaker of the House Nancy Pelosi has been in the position before during presidential speeches, but with the addition this time of Kamala Harris, the nation's first female vice president, the two people seated behind and on either side of Biden was history in making. And of course, this moment marked a milestone in United States of America's nearly 245-year-old history. Here's more.
Thank you all, Madam Speaker, Madam Vice President. No president has ever said those words from this podium. No president has ever said those words, and it's about time.
And it is true. No United States president had ever said the words that Joe Biden said in his opening remarks of his first address to a session of Congress on Wednesday night. It was for the first time in American history that two women, Vice President Kamala Harris and House Speaker Nancy Pelosi, sat behind the president. The Congress burst into cheers and applause as US President Joe Biden handed over the copies of his speech to the women. Joe Biden on Wednesday made a speech just before completing 100 days in office, his oath in January this year. In his scaled-back address attended by just 200 people due to the pandemic, US President Joe Biden proposed a new sweeping $1.8 trillion American Families Plan.
Tonight, I come to talk about crisis and opportunity, about rebuilding the nation, revitalizing our democracy, and winning the future for America. 100 days since I took the oath of office and lifted my hand off our family Bible and inherited a nation, we all did, that was in crisis. The worst pandemic in a century. Now, after just 100 days, I can report to the nation, America is on the move again.
The new proposal of $1.8 trillion has come in addition to his earlier $2.3 trillion job and infrastructure plan. The new plan includes about $1 trillion in investments and $800 billion in tax credits over a decade. The plan will be fully offset in 15 years. The American Families Plan will make education more affordable and expand opportunity. It will provide economic security for families and expand tax credits that help workers and families. According to the White House, the plan will ensure 2 free years of community college for millions of Americans. It will also give universal access to high-quality free pre-K for 3 and 4 years old. It will lower college costs for low and middle-class income students. It will invest $9 million to address shortages of teachers and increase the number of teachers of color. It will provide comprehensive paid family and medical leave, allowing workers to take the time they need to take care for a new child, their own serious illness, or a seriously ill loved one. It will also lower healthcare costs by making the American Rescue Plan's health insurance premium reductions permanent, saving families an average of $50 per person per month. And all will be done with the help of rich and ultra-rich Americans. Biden, in his speech, urged the wealthy Americans to rise and pay the fair share. Joe Biden also appealed to the Democratic and Republican lawmakers to find common ground as they prepare to meet on the 12th of May. He also urged Congress to enact police reforms in the name of George Floyd to coincide with his death anniversary on 25th of May and praised his administration's handling of COVID-19 crisis. Bureau Report, D-Day India.
And more international news. Demanding release from prison, jailed Russian opposition leader Alexei Navalny on Thursday pleaded that the case of defaming a World War II veteran against him was forged one. Navalny, in a Moscow courtroom, verbally attacked Russian President Putin and the Russian justice system as the authorities piped a blurry video and put new legal pressures on him, which he called fake. Navalny, who is currently serving a 2.5-year jail term, declared a hunger strike last month to demand better medical care for leg and back pain. Navalny was arrested in January after coming back to Russia from Germany, where he survived an attack with a nerve agent. And with that, it's time to say goodbye to our viewers. But do join us for Doctors Speak at noon, tomorrow at 3 in the afternoon and 7 in the evening. Remember, these are our live Infono programs. 1 hour duration. Will be flashing our telephone numbers, and you can call and speak to the doctors directly with all the COVID-related queries that you have. And also, as me and my team thank you for joining us on Newsnight tonight, a firm reminder, even if you're indoors, masking really helps. COVID protocols, the only way to save yourself and your loved ones from the virus. Thank you so much for tuning in. Namaskar.